Once again, welcome to our fourth edition of PetPod by Intas Animal Health team. So, a very warm welcome to all our esteemed customers, all veterinarians from across the country, and there are some international participations also. So, we welcome you. So, this edition has come with something new about the emerging specialties. And we have an expert on the topic about the ophthalmology. Uh, Intas, basically, you all know, is very active organization in the front of uplifting the knowledge and the skills in the veterinary field. And our constant efforts are to increase and support the upliftment of the knowledge of all our veterinarians, including budding veterinarians, because we can also see that a lot of veterinary students are also oftenly joining our program. So they should also benefit from this particular PetPod platform. We basically believe as a company that company must talk about the knowledge. It's not only about the products. And when it comes to knowledge in a companion animal health, it becomes very important to talk about the emerging specialties. And today we talk about the veterinary ophthalmology, particularly in the companion animal health sector. And as you know that the companion animal health, this particular segment is growing very fast in the country, and with that number of breeds are also coming in the country, and varieties of breeds are increasing. So breed specific profiles and breed specific diseases, the incidences are also observed by number of vets in the field of skin, or whether it's a otology, or it's a cardiology, or it's a oncology, or even ophthalmology. So this time we chose another specialty about the ophthalmology. And you know well, there are almost 6 or 7 breeds which are quite predisposed to the eye problems. And not going apart from this topic, but they basically, these breeds, they are either small size breeds, short nosed breeds, or they are the breeds which are quite unique, like spaniels, huskies, poodles, Collie, or even you say Boston Terriers, Great Danes, and of course GS. These are the 6, 7 breeds which are quite prone to the eye diseases. And apart from that, there are other breeds. We are not going to talk about these breeds basically, but it builds the idea that with growing population of new breeds in country, the ophthalmologic challenges are growing. And with that, other specialties, the attention is also growing. Uh, when we see about the veterinary ophthalmology, the Merck Veterinary Manual says very clearly that ophthalmic emergency requires rapid diagnosis and appropriate and sometimes aggressive therapy for maintenance of the vision. And these emergencies, they can range from traumatic proptosis, corneal injuries, penetration of foreign objects in the eye, or just penetrating injuries, even a glaucoma, inflammation of the optic nerves, and sometimes retinal degeneration, and so on. There are many conditions. And with growing incidences, with a growing pattern of pet inflows in the clinic, you encounter variety of problems. So we at Intas Animal Health, we believe that we would like to strengthen your hands, we would like to strengthen your knowledge, and we would like to make a value addition to your day-to-day practice through this particular topic. Though we do not have product range, but we strongly believe in that emerging specialties should be talked about, they should be discussed, and they should be brought to the national forums, particularly on such a widely viewed platform like PetPod. And we are very happy to tell you that all our PetPod programs, they are very successful, and they have been largely viewed and participated by a number of veterinarians across the country, even out of India. And following this program, you will find this recordings available on YouTube channel. We have a PetPod YouTube. You just type PetPod, that's it, and you will find a YouTube channel, and you can subscribe, and you can definitely, if you like the video, press the like button so that more and more viewers are they get in their search results. Not going further, I would like to introduce our special guest speaker today, Dr. Narendra Chauhan. Welcome, Dr. Saab.
Well, thank you very much.
Yeah, thank you. Dr. Narendra Chauhan is a very dynamic veterinarian. Basically, he's a veterinary surgeon, veterinary physician, and veterinary ophthalmologist in the working in the Indore with his Myra Pet Clinic and Surgery Center. He highly specializes in the ophthalmic issues in the central India, and he is one of the strong, knowledgeable personality in the field of veterinary ophthalmology. And he has been with the government for quite a number of long years, around up to 2018, and then now he's fully focused into his own private clinic and work. And to note that he is a lifetime member of the International Association of the Society of Veterinary Ophthalmology, USA, and that shows his keenness and that shows his basically eagerness to grow in the field of ophthalmology and share the knowledge. And I'm sure that his today's session, which is going to last about 45 minutes to 1 hour, I'm sure that it will be quite interesting for all the participants. And at the end, he will be happy to answer your questions. He will, because this program is live, let me tell you, and you have a chat box. You can freely type your questions, and we will see that most of the important questions are answered today. And we assure you that in case any question remains unanswered today, do not feel that you are not answered, but our team will get back to you. So our entire technical team will get back to you in the next week with all answers in the written form from Dr. Narendra. So today, Dr. Narendra, you are here with us, and happy to see you with us.
Thank you. Thank you very much.
Yes. So Dr. Narendra Chauhan.
Thank you, sir. So, my dear friends, today we are going to talk about ocular emergencies, and we'll try to make your life easy by giving some simple tips to you. Though few conditions are there which are not very easily manageable, like you cannot manage it just by medicines only. We need to develop some surgical skills also to tackle these ocular emergencies. But I'll try to I'll try to give you some simple techniques or maybe some simple tips so that you can manage this ocular emergencies. So we'll start with few conditions. I'll talk about like 5 to 6 conditions which are very common in our clinical practice. And uh, let's start our today's topic, ocular emergencies. And uh, when we are dealing with ocular emergencies in our patients, for the first 5 minutes, you have to forget about the eye problem. Even if the eye problem is very obvious, you have to always keep in mind that your patient is coming from a car accident, maybe a fight, maybe a wound is there, or maybe is having a blunt trauma. So you always have to keep that in mind before attempting the eye problem. So, and I'll tell you why it is very important to overlook the eye problem in initial 5 minutes. Because when we see the eye problem, like when you see a case of ocular trauma, that eye problem may be the smallest problem in the patient, and maybe the animal may be having some bigger problem, maybe some major problem like head trauma. There may be pneumothorax, hemothorax, or lung condition, which can be life threatening to the animal. So if you focus only on the eye problem, then you may not be able to save the animal. So for the initial first 5 minutes, you need to overlook the eye problem. You have to examine the animal completely. Then only you can uh, then you only go and check the eye problem. So first you have to you have to do a complete physical examination of the animal first. You have to make sure that animal is not having any life threatening problem. Then only you can attend the eye problem. So you have to make sure that animal is not having any life threatening problem. Then you can go and check the eye problem. And what are the common eye problems we generally see in our practice? Like we see ocular trauma, scleral wounds, palpebral wounds, third eyelid wounds, some ocular foreign bodies, Sometimes we corneal diseases are very common. Corneal problems are one of the most common problems we face in our clinics. Glaucoma is there, lens luxation, and retinal detachments. So these are some of the problems. And what are the clinical signs? Normally, when an animal come to your clinic with the eye problem, with an ocular emergencies, we generally see like blepharospasm will be there, rubbing and purring of the eye will be there, epiphora will be there, lots of tearing will be there. These are all signs of pain. When animal is in pain, he'll show this type of signs like blepharospasm, epiphora, rubbing of the eye. There may be change in the color of the eye. Like sometimes you'll see the blue colored eyes, and it is very common in cases of like glaucoma, uveitis, or some corneal ulceration. And sometimes you see the red eyes. Red eyes are very common. Like if some trauma is there in the eye, you may see the red eye. Like hyphoma will be there. Hyphoma is nothing but just blood in the eye. Sometimes in cases of glaucoma, you'll also see the red eyes. In cases of uveitis, you'll also see the red eye. So these are normally, these are the clinical signs we generally see in ophthalmic emergencies: change in the color, uh, and pain in the animal eye. And what is the empirical treatment for such conditions? Generally, what we have to do, the basic first treatment, what we have to do is we have to stop deterioration of the condition. We have to stop that. We have to prevent that animal is not getting deteriorated at your clinic. So generally, we have to protect the eye. Generally, you can protect the eye with some topical solution, some topical gel, or maybe you directly you can put e-collar on the animal. And if the animal is becoming very aggressive, very restless, you can go with the sedation also. And uh, you have to give pain medication in very early in your treatment. Like generally, I prefer to go with the carprofen and tramadol, and both these drugs are available in injectable form. Or no, if animal is not allowing, I mean, animal is not taking orally, then you can give injections of this drugs also. And if there is severe uveitis in cases, which is very common in ophthalmic emergency cases, uveitis is very common. You can give topical atropine drops also to the animal in the eyes. But you have to make sure that your patient is not suffering from glaucoma. Like if your patient is suffering from glaucoma, then you cannot use this homide drops. So you have to give some systemic anti-inflammatory drugs, as I've already gave you which drug you can use. Like you can use tramadol, carprofen. These are the common drugs. And you have to be very cautious when you are using this topical anti-inflammatory drugs, because when a corneal problem is there, some corneal ulceration or deep ulcer is there, and if you are using some corticosteroid or some anti-inflammatory drugs, it may worsen the condition. So you have to be very careful about the drugs. I mean, you cannot use topical anti-inflammatory drugs in each and every case, as they delay the corneal healing. So you have to be a little careful with those drugs. And now we'll start talking about few common conditions. The first condition which I'm going to talk is the proptosis. Proptosis is very common condition, and proptosis is nothing but the forward displacement of the globe, and there is an entrapment of the eyelid behind the equator of the globe. So it is a very common presentation. Just by the seeing the eye, you know it that your patient is suffering from proptosis, and you have to treat this, you have to attend this case immediately. Otherwise, the animal may lose the eye, may lose the vision. And there is a few breeds are very prone for this condition, especially brachycephalic breeds. You must have seen many pugs in your clinics with proptosis. I have seen like Shih Tzu also is one of the breeds where I have attended case of proptosis. And it is, in my experience, it is more common in dogs rather than in cats. Actually, I have seen more number of dog cases rather than CAT cases in my practice, because we do not have a large number of cat population, maybe because of that. But those places where cat population is more, maybe they must have seen such cases more in cat population also. And when you see proptosis in breeds with the long nose, then you must note that this condition is not very common in such type of breeds. If you see proptosis in such cases, then you must go for a complete physical examination, because a considerable trauma is required uh, uh, to occur such condition in dolichocephalic breeds or mesocephalic breeds. So you have to make sure that you are completely going for the physical examination before attending this proptosis, especially in such breeds. And why proptosis is an emergency? Proptosis is an emergency because it can cause blindness to the animal. It can cause permanent blindness to the animal. Sometimes globe perforation may be there. It can be very painful to the animal. And sometimes, it can cause some corneal lesions also. Corneal ulceration is also common because the animal is not able to blink. And that is why sometimes we have to attend it very early in the presentation. And what is the primary treatment for proptosis? As I told you, whenever a case of ophthalmic emergencies come to your clinic, you have first thing that you have to do is to give pain medication, carprofen and tramadol. I've already mentioned. Maybe you have to give some systemic analgesics, and you have to protect the eye. You can use some topical lubricants which contain like hyaluronic acid preparation, carboxymethyl cellulose preparations, and you have to keep it moist so that the condition doesn't get worsen. And you can start with some topical antibiotic also. And what are the clinical presentations in proptosis? They are very clear. I mean, just by seeing the dog, you can it that the dog is having proptosis. And here are few pictures of the proptosis. One case of in the left side, you can see one pug. Another case in my right side of your screen, and a few more cases of proptosis. You can see here eyes completely out of the socket, and lots of bleeding is also there, and few extraocular muscles are also torn. And you can see few more such cases. I mean, another case with the proptosis. So this is the clinical presentation of proptosis, and just by naked eye you know it. Okay, this is a case of proptosis, and we need to attend this case immediately. And before we after giving the primary treatment, we have to make sure what we are going to do and how we are going to tackle this condition. Few prognostic factors you have to consider before you start your treatment. And PLR is the common test which generally I prefer to do when case come to my clinic. A direct PLR, if we are getting a sign of direct PLR, then it is a very good sign. This type of dogs will have a great potential for vision. If there is no direct PLR, that dog may or may not be have vision. Sometimes we have a constricted people always indicate, I mean, it is a sign of pain. If the people, sometimes we have dilated people also because of the oculomotor nerve paralysis injury to that nerve. But when you see the constriction, it is always a sign of pain. So constriction or dilatation may or may not be a true indicator of vision. But if you are getting a direct PLR, if the direct PLR is positive, it is a very good indicator of vision. But if you do not get positive PLR in the consensual eye or the other eye, then it is a very bad sign of vision. If the consensual reaction of the other eye is negative, then you may not get the vision in that eye. So it gives a very good indication about the vision of the animal, as generally the owner always asks whether my animal will see after surgery or not, or after the treatment or not. So just by PLR you can assess the condition of vision. Another thing that you have to keep in mind is the loss of extraocular muscles. Generally, it is said when you lose more than 2 to 3 muscles, 2 to 3 extraocular muscles, that eye is not good for replacement. Such eye should be removed so that the animal will have less pain and animal will be comfortable. And generally this type of eyes are not good for cosmetic purposes and not good for vision purpose. I mean, there will be no vision, and even after you replace the eye there will be lot of pain. So such eye should be removed. Another thing, sometimes corneal ulceration will be there, sometimes the collapse of the eyeball will be there. So you also have to consider these factors while taking into consideration, I mean, when you are assessing the eye. And when you see a lot of intraocular hemorrhage in the eye, that is also not a very good prognostic sign. Like, it indicates a poor prognostic sign. So when you are seeing a lot of blood in the eye, it is not a good prognostic sign for a case of proptosis. And another important prognostic sign is intraocular pressure. Like, if you are able to measure the intraocular pressure, if you have the instrument, you should do it. If you get very low intraocular pressure, then there are chances that the eye has ruptured, and I will be very soft in such cases. And when the eye is very soft, you will get very low intraocular pressure. So very low intraocular pressure is also not a very good sign. And if you can do some fundus examination, then you can also go through it. You'll see ischemic areas of retina, bloodless blood vessels, and hyperrefractive retina will be there. So if you are able to do the fundus examination, you should also go with the fundus examination to assess the condition of the eye. And what is the prognosis of proptosis, and what lies ahead? If you see a case of proptosis, if you replace it, what are the chances of vision? There was a report which says only 27% of the dogs with proptosis regained vision. It is not a good news, especially if you are dealing with a brachycephalic dogs, then there are very high chances that the vision will be there. But if you are dealing with the mesocephalic dogs or dolichocephalic dogs, there will be very less chances that those dogs will regain the vision after the treatment. And when it comes to cats, there are very few cats, or almost no cat regained vision after the proptosis. This is not a very good sign for cats. But if a case of proptosis come to your clinic, especially of the cats, then there will be very less chance that the cat will regain the vision. So prognosis is based on basically two outcomes. I'm talking about the owner's point of view. Generally, they'll always ask if vision will be there, or what will be the cosmetic appearance of the eye after the surgery. So you have to consider these factors. Vision will be there, or the cosmetic appearance will be there. So you have to decide accordingly. Now, what is the therapy of proptosis? Well, the general rule is that you can always remove the globe anytime, but you cannot put it back. So the first thing that should come to your mind, that you should always put it back. How bad it may look, the first thing that you should consider, that you should put it back. Otherwise, I mean, even if the eye is very worse, you can remove it later also. But if the owner is ready to take the operation, if he is ready to go for the operation, you should replace it back. And now, when you have to go for the nucleation, when and how you can decide that this dog is not good for the surgery or the replacement, you should go for the enucleation directly without considering the replacement. There are 2-3 factors which you have to consider. First is when the owner is very pragmatic, owner is not ready to go for the operation, owner is not ready to take the expenses, or when the owner is not ready to do the post-operative care of the animal. In such cases, it is better to go for the enucleation. Or if you see that the eyeball is very soft, then probably this type of eyes may have ruptured, and normally you don't see the rupture from the front. Generally the rupture is posterior. So if the eyeball is very soft, you should go for the enucleation. uh, and if very few, if like more than 2 to 3 extraocular muscles are torn, it is better to go for enucleation rather than going for the replacement of the surgery. And if you see a lot of intraocular blood, then it is better to go for enucleation rather than go for the replacement surgery. So these are the few factors which we have to consider when we are going for the enucleation. And now when after considering all the facts, you feel that this patient is good for the replacement surgery, you have to go for the replacement surgery. Replacement of the these eyes are very easy and very simple procedure. You have to sedate the animal, and sedation, I mean, there are, I have a choice of sedation. I always keep many types of drug for sedation. Like for general surgery, I'll keep different drugs. For these type of conditions, I keep different drugs. But as far as sedation is concerned, you have to consider what drugs are available with you, and then you have to decide accordingly. But you can choose any type of sedation in which you are comfortable. So no specific sedation drugs for proptosis, but the procedure for replacement of globe is very simple. Like for any general surgery, you have to prepare the animal to the eye. You have to prepare the eyeball. Sometimes I use a normal saline BSS or linger rectitate solution to clean up the eye. You have to clean the eyelids. You have to cut the hairs and prepare the eyelid like any general surgery. And generally, I start with the lateral canthotomy. Lateral canthotomy generally releases the pressure on the eyeball, and replacement becomes very easy if you do the lateral canthotomy. And after lateral canthotomy, you have to put few horizontal mattress sutures through the eyelids, and few 2 to 3 sutures generally are sufficient for this purpose, horizontal mattress sutures. And it is recommended that if you use some rubber bands, rubber bands or IV tubing, so there will be no tension by the sutures. I mean, there will be no tearing of the skin by the sutures. So it is always a good idea to use rubber bands or IV tubing. And once you have pre-placed your sutures, horizontal matrices sutures, all you have to use one scalpel handle. You have to lubricate it with some gel, and you have to start your procedure. You have to pull the eyelids, and this eyeball will be replaced back to its position. And as I said, you have to use this flat BP handle. You can use this BP handle for this purpose. You have to pull the threads, and once you pull the threads, eyeball will be inside its position in the orbit. And basically, when you're using flat surfaces, it has two benefits basically. The sutures will not be rubbing the cornea, so there will be no further damages to the cornea. And when you pull the sutures, actually it allows the forward movement of the globe, sorry, when eyelids are being pulled up. So these are the two benefits of using flat surface than pulling the threads directly. And you have to, generally I use this suture of figure of 8 suture for closing of this canthotomy suture, and the rest of the area is suture with simple interrupted sutures. And you have to you have to go for the proper placement of horizontal mattress suture also. I mean, your horizontal mattress suture should be proper. I mean, it should go like 5 mm behind the eyelid margins, and it should come out through the meibomian gland opening. And again, when you are going through the other eyelid, it should enter from the meibomian gland opening, and then coming out through like almost 5 mm behind the eyelid margin. So if the sutures are proper, then sutures are not going to irritate the cornea and further create problems for you, or further uh, create like post-operative swelling or ulceration in the cornea. So proper placement of suture is also a very important factor when you are doing this procedure. And it is a very simple procedure. Within few minutes, you can do it. And these are this is the one photo, the post-operative photograph. Once you have done this, you have replaced eyeball back in the orbit, you can see, and you can tie these sutures, each suture, and you have to keep little space in the medial canthus area, so that you can put few medicines from there. So these are this is the final outcome after the surgery, and it's very simple procedure. It will hardly take like 5 to 10 minutes to do it. So it's a very simple procedure, and you must learn it, and uh, you must be able to do it. Again, few more pictures of the one dog where we have like uh, replaced the eyeball. Few more pictures. So this was all about proptosis. I mean, it is a very common presentation in our clinic, and you'll get many cases of proptosis at your clinic, and you can easily manage it. And what after post-operative care you have to do? First, you have to put one e-collar at least for few days, because these sutures are irritating when the animal is having pain or swelling in the eyeball. They tend to rub or paw their eyeball a lot. So you have to give you have to put e-collar 24/7 on the animal. You have to give systemic steroids to reduce the swelling. You have to give systemic antibiotics also. And as I said, you will put a little space in the medial canthal area, so you can put drops from there also. And as I've already told you, that you have to leave small eyelid opening medially, just to give topical antibiotics, some topical steroids, or some other medications. And sometimes you have to consider, I mean, you should be considering giving serum also. Like, you never know, sometimes you are not able to see behind the eyes like for 2 to 3 weeks. So sometimes if the cornea get I mean, there is problem in the cornea, serum will also help in such cases. So you can also think of putting the serum drops in the eyeball. And what is the long-term complication of proptosis? Generally, the most patient retain dorsolateral strabismus, which is very common. And I have also seen in almost all the cases that the patients have a dorsolateral strabismus. So, but generally it improves with time also. Not in all cases, but in most of the cases, it improves with time. There will be decreased tear production, so you have to keep the animal on the tear replacement solutions for a very long time. And sometimes corneal denervation may be there, so you have to think of that also, and you have to start treatment for that also. So this was all about proptosis, and now we'll talk about another condition, that is desmotocele. As corneal problems are one of the most common problems in our practice, like if I'm getting 10 eye cases, almost 6 to 7 cases will be of corneal problem, maybe some simple corneal ulceration or some deep corneal ulceration or desmotocele or maybe melting cornea. So desmotocele is another very ocular emergencies, and which you have to attend very promptly. If you delay attending this problem, then you are inviting troubles for yourself. These are the, this is the common presentation of desmotocele, and this is how a desmotocele look like. Mm, Generally, when we see at desmotocele, there will be focal area of extreme thinning on the cornea, and generally the desmotocele look like very dark in appearance, unlike the other area of the cornea. You can see in this picture there is a black area in the center in in the eye. That area is desmotocele, and when you do it the fluorescein staining, there will be donut shape of stain pattern. You'll observe in the above picture, the picture in the right top corner, you'll see the donut shape of stain pattern is there. So just by seeing this pattern, you knowing that you are dealing with the desmotocele. And why desmotocele is an emergency? For that, you have to learn that basically cornea is a four-layer structures, and the upper part is the epithelium, which is like 7 to 8 cell layer, and the rest, the rest of the part is like almost 90% of the part is stroma, and in the last part is the desmet membrane and endothelium. Endothelium basically is a single layer structure and very thin, and desmet membrane is just 5 to 10 microns thick. I mean, when this desmet membrane is exposed, when the 7 to 8 layers of epithelium is gone, almost 90% part of the cornea is gone in the form of stroma, then you have this desmet membrane and endothelium only, which is just, as I said, 5 to 10 microns only. And this thin desmet membrane is not able to bear the intraocular pressure for long, so it is almost on the verge of rupture. So when you are dealing with a desmotocele, you have to attend this case very and you have to do, you have to attend or do very aggressive treatment for desmotocele. Otherwise, you are going to invite troubles for yourself. Here in this picture, you can see in the left side, you can see how the superficial ulcer look like, how the deep ulcer look like, and how the desmotocele look like. So when you are dealing with desmotocele, as I said, it's a very thin layer, less than 10 microns. As I said, 5 to 10 microns only. So it cannot hold the pressure, little pressure, and the eye is going to get rupture. So you have to attend this case immediately. And this is the typical presentation of a desmotocele. You can see all the part of the cornea is gone, only desmet membrane is there, and if such cases are not attended, then I can get rupture anytime. Another case, you can see, I'm going to show you a few more pictures of desmotocele, so that whenever you see such thing, you immediately recognize it, that it is a case of desmotocele and you have to do some aggressive treatment. You can see all the pictures of desmotocele, and you can see one dark area in every picture. This dark area represent the desmotocele, and this is the desmet membrane. The white area is stroma, and that the glistening area is epithelium. So whenever you see a dark area, then you are sure that you are seeing a desmet membrane, and it is a case of desmotocele. So you have to attend it. Few more pictures of this desmotocele. You can see the dark area in the pictures, and these are the these cases you have to attend very promptly. And what are the normal causes of corneal ulceration? Why I'm telling you, sometimes we are not able to attend. I mean, we see a lot many cases of corneal ulceration, and when these cases are not attended properly, it may turn into desmetoscele. So we must know the basic causes of corneal ulceration, like inadequate corneal protection, excessive epithelial loss. There can be tear film deficiencies, eyelid dysfunctions. Sometimes there may be endogenous causes, exogenous causes, KCS, leg ophthalmos, like in cases of pugs, and entropion, dyschiasis, ectopic cilia, lid tumors, blepharitis, and sometimes trauma also. So you must know the basic reason for corneal ulceration. If you know the basic reason of corneal ulceration, you can treat all those conditions in a much better way. So what is the treatment for any corneal ulceration? Treatment is very simple. You have to use some antibiotic. Generally, my preference is always triple antibiotic, neom. It generally contains neomycin, polymyxin B, maybe with bacitracin or gramicidin. So generally, triple antibiotic works better, much better. And if we are suspecting any gram-negative infection also, then you can use some fluorochemicals and drops also, such as moxifloxacin, gatifloxacin, or such drops are very easily available nowadays in our veterinary practice also. So you can use those drops also. Uh, and you have to go for the mydriatic therapy also, like because when you see such cases, there will be reflex uveitis will be there, and there will be a lot of pain. So for mydriatic therapy, you can use atropine 1% drop, which is very easily available in the market. So you can use this atropine drop also. It is very good for pain, to stop the pain. And you have to prevent the self trauma also. So you have to put e-collar for such cases, for simple corneal ulceration, maybe deep ulceration. And now we'll talk about the treatment for desmetoscele. This was the treatment for simple ulcer, but now we'll talk about the desmetoscele. As I already told you that desmetoscele is an emergency, and now what we have to do, like when we are going through the treatment of desmetoscele, the medical management of desmetoscele and simple corneal ulceration is more or less same, but the frequency of your treatment, your that has to be very high. I mean, like if you are using antibiotic drops twice or thrice a day, in cases of desmetoscele, you have to increase it up to like 5, 7, or 8 times also. Generally, I prefer to go as many as times as possible. And I also give mydriatic therapy a lot initially. Once I see that, yeah, the people are sufficiently dilated, then I keep it to twice a day. But initially, if the people are not sufficiently dilated, I may go with like 3. I mean, I may put atropine drops like 4 or 5 times a day. Once sufficient dilatation is sufficient, then maybe twice a day or once a day atropine is sufficient. But initially, you have to, your frequency has to be very higher. But generally, as I said, it is an emergency. But my preference always, when I see a case of desmetoscele, I generally prefer to go for the surgical treatment, because I know it. Sometimes owner is not compliant. They may not put the drop the way you want to. I mean, the frequency may not be there. If you ask them to put the drops like 6 times a day, he may not do so. And 2 days later, he'll come and say, ki, sir, the condition has worsened. And when I came to your clinic, my dog was little better. And after your treatment, the eye is even more worse. So generally, I prefer to go for the surgical treatment. Few things everyone can do. Like you can, when it comes to surgical treatment, trausorrhaphy is a very simple procedure. Anyone can do it. You can go with the simple tarsorrhaphy, or maybe you can go with the third eyelid flap. It will give a mechanical support to the eye, and it will help a lot. While you are giving the mechanical support to the eye with the tarsorrhaphy and third eyelid flap, at the same time you can start the topical medication and systemic antibiotics also. Uh, and another thing that I would like to tell you, you can use collagen contact lenses also, white shields. These are available nowadays in our country also. If you do not get this white shields, then you can use human contact lenses also for this person. That works also and good for the dog's area. You put the contact lens on the eye and just make a third eyelid flap. That will also do quite good in most of the cases, and your I mean the patient will be much better after a few days. So these two things everyone can do. Like you can go with the tarsorrhaphy, maybe simple tarsorrhaphy or third eyelid flap, or you can use some contact lenses also, and they are very cheap. I mean they are not very costly and very easily available, so you can go through this. But few advanced things, when you see that generally which we are doing in our practice, we generally go with the conjunctival flaps, cornea conjunctival flaps sometimes, and we use grafts also. There are different types of grafts also which we do in our practice. But as I said, one and two is for everybody. Like everyone can do this tarsorrhaphy. It's very simple. Third eyelid flap, very simple. At the same time, you can go with this contact lenses. They are also very easily available, and you can do. I mean, everyone can do it. So one and two options is for everyone, but three and four, for this actually you need some instruments and skill also, because when we are doing this conjunctival flap, we generally use operating microscope, and we are using very thin sutures. Like we are generally using 80 suture. So generally 80 suture is very thin suture. You cannot, I mean, it's very difficult to see it by naked eye, and it requires a lot of practice to suture it. So if you are thinking of conjunctival flap, corneal graft, so you'll need to have some instruments and skills also, and the practice also. And if you want to learn ophthalmology, you should start doing it, and it will definitely give you much better results. So these are the some of the surgeries which here one case of conjunctival flap. You can see the dark black area here in the center, and now you can see the this eyes conjunctival flap is done here. In this case, you can see here. So another case of a dog, you can see how beautifully it is done. Conjunctival flap, you can see one dark area here in the center. This dark area is and Descemet membrane. And whenever, as I told you, that whenever you see a dark area in the center, you are 100% sure that you are dealing with the descemetocele. It may look very small, but it is an emergency. You have to attend very promptly. And this is the conjunctival flap. Another one more case of this conjunctival flap. You can see how beautifully it is done, and it's looking very nice. One more case. And as I said, we are using dry amniotic membrane also. These membranes are also very easily available, and this works also better. If you are not, I mean, you don't want to go with the conjunctival flap, you can use this membranes also. And here is one example, a case of descemetocele, and we have used this dry amniotic membrane. You just a simple membrane will be there. You have to just suture it. It will give a very good support. And nowadays we have more advanced grafts are also available, like ACLs, and ACLs are also available here in our country. But all those products are little costlier. But compared to this, amniotic membranes are little cheaper and will get. I mean, even the humans are also, human ophthalmologists are also using it. So you can get it from any local shop. and you can put this amniotic membrane also. You have to just put this amniotic membrane on the defect and you have to suture it, that's it, and you are done with the surgery, and it gives generally very good results. And this is one more example of the amniotic membrane. Here it was the defect and it was post-operative picture. And this was all about the desmetocele. So whenever a case of desmetocele come to your clinic, always suggest, I mean, to the owner to go for the surgical treatment. If the owner is very reluctant, not ready to bear the expenses, then only go for the medical management. But in my case, I generally prefer to go for the surgical treatment, even if I do not see the Descemet membrane, even if the 50% of the cornea is lost, then also I will go for the surgical treatment rather than the medical management. And keratomalacia, melting cornea, this is also a very common condition in our practice. And initially when I was in my college days, when I was doing my UG and PG, what used to happen whenever I used to see a case of eye, I was always taught that whenever a case of eye problem comes, you always use corticosteroids, always give subconjunctival corticosteroids. And when I started learning ophthalmology, I came to know that if you are saying I'm seeing a corneal problem, if little ulceration is there, any topical anti-inflammatory drug, any corticosteroid is strictly contraindicated. And I have seen such cases that when you use corticosteroid in the eyes, a simple ulcer can become a melting ulcer or melting cornea. Here is the one example, few pictures of melting cornea. You can see the melting here in the center. Otherwise, the eye look absolutely okay, but the melting is there. This is going to be very worse in 2 or 3 days. So this type of cases you have to be, I mean, you have to attend a very aggressive treatment. We have to resolve. So few more pictures of melting. Here you can see the melting is there. Here you can see this Descemet membrane is exposed. Say again, you can see this melting is there, but again Descemet membrane is also exposed. Little infection is also there. Here you can see. So these are few more pictures of the melting cornea. So now, what is the treatment for melting ulcer or melting cornea? Generally, as I said, antibiotics you have to always give, topical as well as systemically. And generally in such cases, I go with the fluoroquinolones. That is my choice of drug for such type of cases. Atropine drops 1% topically, and once I get the sufficient dilatation, then I stop. I mean, just then I give once a day only, and sometimes I go with the systemic anti-inflammatory drugs also, followed by hyaluronate tear replacement solutions also. And the most important thing in the melting corneal ulceration is the serum. Like I prefer to go with the serum like every hour. Autologous serum, you can use the autologous serum as well as serum of other species also. I mean, serum will work of animal. It is not required generally, like this corneal melting corneal ulcer you see in cases of pugs. It is very common in pugs, but like when you take out the blood, sometimes blood, there will not be sufficient blood, and when you do not have sufficient blood, then you may not get the sufficient quantity of serum. So if you are not getting sufficient quantity of serum, you can take the blood of another dog also. In fact, you can take the blood of another species also. You can take the blood of horse also, and it is equally good. So If you are using the serum, it is not at all required to use the autologous serum. I mean, if you are getting autologous serum, it is the best thing. If you are not getting the autologous serum, then you can use the serum of other animal also, or in fact other species also. So generally the main line of treatment would be the serum. I will put a serum like every 1 hour until this melting stops. Once the melting stops, then only I will not put the serum a lot of time, like every 2 hours. Then it will be like 3 to 4 times in a day, and then gradually reduce it. So, and one thing I would like also like to tell you about the serum is that you can use the serum up to 7 days. Like there are few literature where it is said you can use it like for 48 hours only, but we have very good experiences with the serum. We can use it up to 7 days, and uh, generally, like, you have to use it and you have to keep it in the fridge, because the serum is also prone for the infection. Like if you keep it openly, then serum may get infected and it can become a source of infection. So once you have taken the serum, you have to freeze it. I mean, you have to keep it safe, otherwise it will be a source of infection. So for melting corneal ulcer, antibiotic, serum, atropine, NSAID systemically, some tear replacement solutions. These will be the line of treatment. And sometimes we, like in such cases, we also go with the surgical treatment. Generally, we put sometimes grafts also. We conjunctival graft, sometimes with go with the amniotic membrane also. Sometimes I do not in always case, but initially, like in melting ulcer, I prefer to do at least for 2 days the medical management. If I'm not able to get the good result, then only I think of the surgical treatment. Another emergencies, ophthalmic emergency, is the corneal laceration. Corneal lacerations are very common. Generally, cat claw injury is very common. Animal may sometimes come into contact with the sharp objects and get the laceration. Uh, there can be like it can be very problematic for the dog if there is collapse of the anterior chamber, if lots of blood is there in the anterior chamber, RF prolapse may be there. So corneal ulceration is also an emergency which you have to be, I mean, you have to attend promptly. Uh, what primary treatment generally we go in cases, I mean, we do in cases of corneal laceration? The first thing is that you have to prevent further injury. Like I already told you early in my this lecture, that you have to prevent further injury. E-collar, you have to go with the analgesia, and you have to make sure that you are not putting unnecessary pressure on the globe, and you have to perform Sigel test also. Sigel test is nothing but you just put uh, you put some, strip of fluorescent dye on the eye. If it is if the I mean, Sigel test is negative, then you can go ahead with the treatment. If it's leaking, then this dye will wash away from the eye. So you'll know that you are dealing with the leaking anterior chamber or not. If the Segal test is positive, like as I said, if the Segal test is positive, then you have to avoid topical ointments, because it may go into the eye, and it can create a lot of uveitis in the eye. So um, you have to avoid if the Segal test is positive. And the medical treatment for this corneal, I mean, laceration is very similar to keratomalacia and desmetosine, antibiotic, mediatic therapy, and if the laceration is little deep, then you can go with the serum also. But generally, this is the line of treatment: antibiotics, mediatic therapy, and that's it. And the prevention, e-collar, and the prevention of further injury. Uh, Here you can see one corneal laceration, which is like suture, which is suture. Everything seems okay now after the suturing. So we can, if suture is not, I mean, the laceration is not very deep, it's very superficial and has not affected the eye, then you can suture it. And I always use 80 suture for corneal suturing. And as I said, it is very thin sutures, you will require a lot of practice to do it. And if you use little thicker sutures, then there will be a lot of post-operative inflammation, which is not good for the vision. So try to use as small, I mean, as thin as possible. 8 or 9 is the best choice. And now, when corneal perforation is there with the iris prolapse, this condition, in such cases, trauma is always a animal will always be having the history of trauma, and this is a surgical condition. I mean, when the iris prolapse is there, you have to repair it surgically. You have to suture the laceration. May have to put some graft on the cornea, and you have to replace back the iris. If the iris is dead, then you have to cut the dead part also. But if you see that iris is not dead, then you have to put it back, and then you have to suture the um, you have to suture the cornea. And if the anterior chamber has collapsed and iris has obviously, when the iris is out, anterior chamber is collapsed, and you are not very used to it, it is always better to refer it to an ophthalmologist or to a doctor who can handle such condition. If the eye with the iris prolapse, with the eye is completely gone, you see that the eye is very soft and it's completely ruptured. It is better to go for the enucleation in such cases, because corrective surgery will not work if the eye is very soft and all the part of the eye is out of the anterior chamber. Here you can see some post-operative picture. Here you can see like iris prolapse, and here the post-operative surgery. Here the thread size little bigger. I mean, it's very I mean, this the thread size is little higher. Generally, this is not the preference. I would prefer to go with little smaller threads or thinner threads. We get cases of corneal foreign bodies also. The animal eyes will be very red. There will be uveitis, and lots of pain will be there. Animal will have a lot of pain and will continue to do rubbing. And the different type of corneal bodies will seen. Generally, they vary in size, shape, and structure, and but their appearance is typical. I mean, they'll always look black and tan. If you see a corneal body, it will always look black or tan. So it is very easy to recognize just by naked eye. All you need to have a very good eyes to check such conditions or to find such bodies. Differential diagnosis is sometimes you see corneal pigmentation, so you have to differentiate between corneal pigmentation and foreign body. Sometimes prolapse iris and corneal sequestrum, which is very common in cats. Such foreign body should be removed. Like in most cases, if the dog is very cooperative and allow you, you can easily remove it with some forceps. If it is very deeply penetrated, I mean, if it is not very deeply penetrated, you can use with a flush of BSS or normal saline. Just a flush, you just load a syringe of normal saline and flush it. Sometimes it get removed very easily with that flush of BSS or normal saline. And after removing the foreign body, you have to treat it like a simple corneal ulceration. Same antibiotics, atropine, and the E-collar, prevention of self injury. And sometimes we get corneal foreign bodies which is penetrating. Such eyes can be very difficult. I mean, there are chances that that penetrating foreign body may have completely destroys the eye. You have to assess the situation. If you feel that, yeah, this foreign body can be removed, eye is okay, then this is the line of treatment. You have to prevent further injury. You have to put e-collar, you have to give analgesia, sedation, and you have to make sure that you are not putting too much pressure on the globe, or you are not worsening the condition. You have to give systemic antibiotics, anti-inflammatory, and you have to remove it surgically. So, as I said, like you have to remove it surgically. There will be lots of post-operative uveitis, because once this foreign body penetrates the eye, it's definitely going to create problem for the internal eye structure. So you have to take care of those problems also. You have to treat for the uveitis. You have to take care of the corneal lesion also. And if the foreign body, like penetrating corneal body, has damaged the eye completely, then you may have to think of this enucleation also. So in general, that is the line of treatment. You have to put Elizabethan collar, some topical antibiotics, Madratic, atropine, and sometimes systemic antibiotics also. So generally, I prefer like amoxicillin, clemenic acid, and sometimes grafting also, some corneal transplantation. Not I haven't done it so far, but yeah, other things I have done. I have put some. I've done some new conjunctival transpositions, grafting, and amniotic manuals. This we have done a lot. And now, once we are done with the, now we'll talk about this anterior lens luxation. It is also a very uh, common presentation. I won't say it's as common as corneal disease, but you'll see this type of cases also in your clinic. And this, if you see a case of anterior lens luxation, it is also an emergency. You have to treat the animal immediately. Otherwise, the animal will be blind, and there will be loss of vision, and a lot of pain will be there, because like what luxation, anterior lens luxation do, it creates, it creates obstruction and the outflow of this aqueous humor. And when there is no outflow of aqueous humor, it creates glaucoma in the eye, and glaucoma is very painful, and within few hours glaucoma can be blinding to the animal. So for as far as anterior lens luxation are concerned, it can be primary. The primary lens luxations are also very common in cases of dogs, and a few breeds are disposed for it. And we consider that when we see a case of primary lens luxation without any apparent reason, so we see in a particular type of breeds only, not in all breeds. And we generally see secondary lens luxation also in cases of blunt traumas, glaucoma, uveitis, anterior uveal tumors, or cataract. And we have to treat accordingly. Like we have to make sure that whether it is primary or secondary. If it's primary, then we have to consider the breed also. If it's secondary, then we have to treat the other problem also. And as I said, it is common in few breeds, primary lens luxation, like poodles, Shih Tzu. Such type of breeds are very prone for anterior lens luxation, and it is the most common in terrier breeds. Terrier breeds are very prone for primary lens luxations. And as I already told you, secondary lens luxation always associated with some diseases like uveitis, uh, uveitis, cataract, or maybe glaucoma. So these are the pictures. These are very good pictures of anterior lens luxation. If you have very good eyes, you can immediately diagnose it that it is a case of anterior lens luxation, and you have to treat. Once you know the disease, then you have to treat accordingly. And this a few more pictures of anterior lens luxation, very good pictures. Just by seeing the picture, you can diagnose the condition, and you can suggest the animals, and the owners what we are going to do. So, but this is the condition it is not so common, but still very problematic for the dog. So few more pictures of anterior lens luxation. Corneal edema will be there in few cases, and which is because this edema will be there because the animal, this anterior lens lux, the lens will be touching the endothelium, and it will result in corneal edema. And clinical signs are very clear. Diagnosis of this anterior lens luxation is straightforward. Just by naked eye you can diagnose it, and all you need the good eyes. If you have the good eyes, you can diagnose the eye conditions very easily. And treatment is surgical for such condition. We generally perform surgical lensectomy in cases of anterior lens luxation. The lens has to be removed because if you do not remove the lens, it will, as I told you, that it will cause glaucoma, and it can immediately can damage the eye. It can be very blinding for the eye. If you do not know the techniques how to do it, it is better to refer someone who can do it. And as of now, we perform lensectomy only for the such cases. So this is some of the pictures of the surgical lensectomy. You can see here I am giving this corneal incision. I am just increasing this corneal incision, and here you can see. And once I have done this corneal incision, I am increasing the length of incision, and here you can see. And once I have done the incision, I am removing the lens. You can see the lens here. This is the lens, and this lens is now out of the uh, anterior chamber. Once you remove the lens, there will be collapse of the anterior chamber, and it is always like generally once the anterior lens luxation occurs, there will be always vitreous attached to it. So we have to do a vitrectomy also. If you do not have this facility of vitrectomy, you can do it manually also. Here you can see I'm doing the vitrectomy manually. I'm just cutting the vitreous from this lens, and this is how we do the manual vitrectomy. Once the lens is removed from the eye, then we have to suture it, and this is the suture. This is, you can see the very thin suture here, very thin suture. You can see very thin suture. So generally I prefer 80 suture, and if you because these are very enlarged images, and I've taken through the microscope. I don't think if you put this suture, you cannot see it with the naked eye. So generally I prefer to do it with 80 only, and you can see the outcome, post-operative outcome in the anterior lens luxation. Uh, very good outcome, and the animal is doing good now these days. I have this case came to me from almost like 400-500 kilometers from my place, and during the lockdown time, and the post-operative result is also good in this case. And now, after this anterior lens luxation, we'll talk about acute glaucoma. Acute glaucoma is also very common and very under-recognized in dogs, actually. Sometimes we are not able to recognize the signs of acute glaucoma. And acute glaucoma is something which is also an emergency. And we call it acute glaucoma whenever the intraocular pressure is more than 25, then we call it as an acute glaucoma. If the pressure goes more than like 50 mm, there are chances that the animal will go blind. Will go blind. If the pressure is 70 to 90, then animal is blind for sure. So if you see a case of glaucoma, again it is an emergency. And as I told you, that it is very painful, it is blinding, and under recognized also. So you have to you should be able to recognize it. What are the normal clinical signs? I'm going to tell you. And as I told you, recognizing fan. This is the tonometer which every clinic should have if you want to deal such cases. It is used to measure the intraocular pressure, and it is very easy to use. Just uh, but little expensive. But now, I mean, it is must if you want to practice the ophthalmology. It is must for your clinic. So with this tonometer, we generally measure the intraocular pressure. If the intraocular pressure is high, then we immediately go for the treatment of glaucoma. And glaucoma can be primary and secondary. Like primary glaucoma, it is very common in cases of dogs. And we also see secondary glaucoma because of uveitis, trauma, anterior lens luxation, and maybe because of intraocular masses, or sometimes because of the cataract also. When we talk about glaucoma, glaucoma is not that common in cats. Generally, we see cases of acute glaucoma, or maybe secondary glaucoma. I mean, generally we see more such cases in dogs only. It is not that common in cats. So we'll see such cases in mostly in dogs only, not in cases. So what are the clinical signs of acute glaucoma? Lots of pain will be there. Like when the animal is having pain, he'll show signs of blepharospasm. He'll start rubbing his eyes, or maybe uh, he'll rub his eyes, or lots of tearing will be there. Sometimes we see episcleral injection. You can see here, this is the episcleral injection. This is the blood vessels are engorged, episcleral blood vessels are engorged. You can see deep 360-degree corneal vascularization here in this picture. 360-degree corneal vascularization. When you see such conditions, there will be corneal edema. Here in this picture, you can see the corneal edema. This is the corneal edema. Here you can see corneal edema, and pupil will be dilated in most cases. Here you can see the pupil is dilated. So these are the common clinical presentation. There will be no PLR, there will be no menace, there will be no DESL responses. So these are the typical presentation of the acute glaucoma. And a few more pictures of glaucoma you can see here. This is the boophthalmus, dilated pupil. Here you can see dilated pupil, corneal edema is there, corneal edema, episcleral injection here. You can see in this picture, corneal episcleral injection here. Few more pictures with the episcleral injections. So these are the clinical signs of acute glaucoma. And what is the treatment of acute glaucoma? Like there are two or three different drugs which we generally use for the acute glaucoma. Prostaglandin analogs are there in the name of latanoprost, travoprost. These are the two drugs which are also available in human practice also. So we can use this prostaglandin analogs. They are very fast acting, but at the same time their effects are not very long lasting. How they work? They generally increase the aqueous humor drainage. And we have carbonic anhydrase inhibitors also in the form of dorzolamide and brinzomide. This type of preparations are nowadays available in veterinary practice also in our India. So basically what they do, they decrease the aqueous humor production. And beta blockers are also available. Timolol is the drug which also, I mean, timolol also decreases the aqueous humor production. So how we are going to deal with acute glaucoma? This is, I mean, not very clear. Like sometimes it is very confusing. So what should I do? I mean, like whenever you see a case of acute glaucoma, what you are going to do? So this is the general line of treatment for the acute glaucoma. All you have to do, you have to start with this latanoprost. You have to put a drop of latanoprost, wait for 5 minutes, and after 5 minutes, you just put 1 or 2 drops of dorzamide timolol solution. And still, if you feel, again wait for 5 minutes, repeat the same procedure at least for 3 to 5 minutes. Then again, remeasure the intraocular pressure. If the intraocular pressure is still high, then again do the same procedure, and again you have to check the intraocular pressure. If the intraocular pressure is still high, then you may have to consider the different options. And when you do not know the cause of the glaucoma, all you can do, if this treatment phase, then you can think of this aqueous synthesis. I mean, you can remove the aqueous humor from the anterior chamber. It will remove uh, uh, by surgically, you can remove just by it's very simple procedure to do it. Aqueous synthesis, you can synthesis, sorry. So it is you can also do that aqueous synthesis. Sometimes you have to use that hyperosmotic solutions also if the pressure is not reduced, like you can use this mannitol IV, but you have to be very careful, because I have seen a problem with this mannitol. If it is not used properly, you can give at the dose rate of like 2 gram per kg slowly for 30 to 45 minutes, and you have to without water during this time. But you have to be a little careful with this drug mannitol, because I have seen problem using it. So if you are not very used to it, better use it very carefully. First get used to it, then use it. But it gives you very good results. And when you have used this mannitol, you have used all the drugs which I have mentioned, still if you are not getting results, then you can do this aqueous synthesis also. It's very simple. You have to sedate the animal, or then you can do the synthesis with this 25 to 30 gauge needle. You have to just remove little amount of aqueous humor. Once little aqueous humor is out of the eye, then pressure will be less, and then you have to check the intraocular pressure, and you can do it like once or twice, and then you can work on the reasons for acute glaucoma. But this is how you deal with this acute glaucoma. So that was all for my TrueSelf's presentation. These few conditions I have discussed, and I hope it was useful for all of you. And if you feel that a few things which maybe which I may not have mentioned, or few things, if few things are not very clear to you, you can send your queries to my mail ID, or maybe on my this mobile number, and I'll be very happy to take your questions, and I'll be very happy to answer your queries. Thank you very much.